So this is patient when my mom calls me up and says, actually she's right here. She calls me up and says, you know, I gave your number to a friend of mine. I'm like, oh God, I know. That's when you drop everything. It's like, don't try to treat them. So she comes in, really elegant woman, very classy, and she's got 3 open heart surgeries in her life. And look at this bridge. I mean, it's amazing, this bridge standing. Long crowns, 50% bone loss. And she says, well, I was referred to somebody else, but I want to come see you. I know you're going to do good work for me. And that's when you're like, oh my God, you know. Double the pressure. My mom and her, and so I know her. She's a really nice lady. So went ahead to do number, I think this is 15. Very calcified canal. There's a separation of the instrument on the MB canal, and as soon as I did that, I just started swelling. You know, oh God, you know. And the good thing about her was she had cold and hot sensitivity, irreversible pulpitis sensitivity, which is, in a case like this, probably the best scenario. I mean, if you have necrotic cases where you have periapical lesions, then you want to kind of inform the patient and do something about it right away, as far as either bypassing it or do an epicoectomy or other issues. But irreversible pulpitis tend to work a little bit better with cases like this. So I went ahead and did a working length. This is actually in January also that I saw her. And this is the final. And then she came back for a 9 months. I just saw her a few weeks ago. And this is a 9 months recall. And apparently I didn't do too much of a bad job because she came back for another tooth. So I was happy with that. She trusted me. So this is an interesting case I'm going to show you. This is not a recall, so just interesting case on a patient that I saw. And when you take a look at this x-ray, what do you see? You see basically a bunch of roots and then sinus, and then you see this other root up here. And that's kind of a too straight of a root for a MB canal. So I went ahead and actually found 4 roots on this one, 2 palatal roots. And this is the final on that. So that was interesting. I thought I've probably seen maybe 5 to 10 of these. Here's number 13. Patient came back. Patient had some necrotic with acute apical symptoms, chewing and percussion sensitivity. So went ahead and did a retreat, and you can see some lateral canals right here, and a whole bunch up there. My only sense out of those is a whole bunch of lateral canals. Here's the final, another angle on that, and here is a 5-year recall. So it's working great.